Hello dear physios and fellow physiotherapy students. Here is yet another very simple and effective technique that can be utilized to treat symptoms such as tinnitus and imbalance issues like dizziness, etc. So to perform the technique, the therapist is going to make the patient lie down in the supine lying position. The right hand of the therapist is going to stabilize the shoulder as well as the first rib and is going to apply a pressure in the downward or the chorded direction. The left hand of the therapist is going to cup the base of the occiput, and now from here we are going to perform the contralateral side bending of the head and neck and ipsilateral rotation. And we are going to hold this position and ask the patient to breathe in. And as the patient breathes in, I am going to give a traction to the occiput in the cranial direction, that is towards me. As the patient breathes out, I am going to release that traction. So breathe in, I give traction. Breathe out, I release traction. Breathe in and breathe out. Perform around 8 to 12 repetitions of such motion and bring the head and neck back to the neutral position. The technique has been shown to improve the arterial flow to the head and neck region by about 30%. And this is one of the hypotheses which is related to improvement in symptoms such as tinnitus and imbalance. So I sincerely hope that this video is going to be helpful to enhance the physiotherapy skills. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.